This video will introduce you to the concept of motivational interviewing and how this can be used to influence behaviour change in your patients. Welcome to Consultations for Health, helping you progress in your communication skills to optimise the care of your patients. This video will discuss some of the ways in which you can help influence positive behaviour change in patients, such as helping them to quit smoking by using motivational interviewing. There are 4 guiding principles to motivational interviewing that fall into the acronym called RULE. The first is resisting the writing reflex, R. Healthcare professionals often feel the need to put things right because they want to help. However, this can be an issue because people naturally tend to resist being persuaded. For this reason, you should avoid putting patients in a position where they are trying to defend their behaviours or justify their actions. They shouldn't be arguing against the advice that you're giving. If they are, you are probably not approaching the situation in the most effective way. If the patient is arguing against you, it may decrease the likelihood of behaviour change. You are in the wrong role if you are trying to convince the patient of something and they are resisting it. For example, if you're telling a patient the reasons why they should stop smoking and they find themselves telling you that you don't understand how stressful their life is, then you are definitely in the wrong position. This is not a positive discussion. You should instead encourage the patient to voice the arguments for change themselves, and then, for example, they may say things like, "Well, I suppose it would save me a lot of money." You must try to suppress what may seem like the right thing to do and help the patient through an ambivalence without lecturing them about the reasons why they should make a change. Secondly, understand your patient's motivation. The patient's own reasons for change, and not your justifications, are more likely to trigger behaviour change. You should be interested in the patient's own concerns, values and motivations. You should aim to explore a patient's perceptions about their situation and their motivations for change. For example, you could ask the patient why they want to make a change, how they would go about doing it, and how they will benefit. If, for example, a patient mentions how excited they are about their grandson being born, but says they're too out of shape to play football with them, you could then discuss this as a motivation to help the patient do more exercise. Next, you must listen to your patient, L. In a consultation, there should be at least as much listening as giving information. The answers to the situation and how to overcome barriers are often within the patient, but to find these answers, you have to listen to the patient really carefully. This is about practicing active listening. Active listening is a complex skill. We've already produced one video on Consultations for Health, which may help you. When listening to a patient, you should show empathy and interest, and make sure that you truly understand and read between the lines of what your patient is saying. If you don't understand what the patient is communicating to you, then ask them or seek clarification. For example, if a patient says, "I feel really iffy about starting a new medicine," and you suspect that they mean they feel anxious about it, explore that possibility. Lastly, on RULE is empower your patient, E. Health outcomes are often better when the patient takes an active interest and has an active role in their own care. You should help patients to explore how they can make a difference in their own health. If a patient tells you they've been checking their blood pressure at home with a monitor that they purchased in the pharmacy, you should acknowledge that this is a really good thing and that the patient is doing well, and encourage these active roles within their own healthcare. The patient's own ideas and resources are also key here as well. you should remember that the patients are the experts in their conditions and their own life, and communicate this to your patients. You should support them in the hope that change is possible and that it can make a difference to their health and their life. You should be encouraging and allow the patient to think out loud about why they should make changes and how they could do it. You should essentially be facilitating the patient to come to their own conclusions. If you haven't already, check out our videos on active listening and negotiating a shared agenda, and they are particularly relevant to this idea of using motivational interviewing. Thank you for watching Consultations for Health. Don't forget to follow us on Twitter, like our Facebook page, and subscribe to these videos.